Hi, this is Dr. Michael Ryan answering the question, how do I know if a skin rash is related to a vein condition? Well, it's not uncommon for a skin rash on the leg to be associated with an underlying vein condition, although it's very frequently missed in the diagnosis with providers and specialists because they don't recognize the association between a skin rash and vein circulation problems. We see it every day of the week, so we're very tuned into the association. So how do you know if it's uh, a rash that's related to the veins? Well, one first clue is the location. If the location is in the inner lower calf around the ankle, that's a very common area where we see a rash associated with vein reflux. The underlying basis for this rash is inflammation that's generated by the stagnant circulation in the veins. The stagnant circulation triggers an inflammation reaction locally around the veins, but also it's uh, kind of leaks out into the circulation and causes you to feel fatigued as well. That's very common. So down in the lower inner calf, sometimes in the back of the calf as well, it's usually red. It could be flaky. Very often there's itching associated with it, and because itching is a sign of inflammation in the tissues, and the itching can be just unbelievable for people where they're scratching, they're bleeding. So we've seen some dramatic situations where that itching gets better and goes away after treatment. It can be higher up in the calf as well, the mid calf, even around the knee. Those cases are always associated with some kind of vein abnormality directly under the skin. Many times you can see a ropey vein feeding into that area, so you can guess that that's what's going on. Sometimes you need to have an ultrasound. So when I see a patient with a rash, and the question is this related to the veins, and therefore would a vein treatment help? Because if it is, vein treatments do help the rash go away. I will look with an ultrasound. I will look right over the rash, and very commonly there's a cluster of veins directly underneath the rash, and that predicts that treatments will really improve the situation. So those are the clues that a rash is related to the vein circulation problem. Ultimately, looking with an ultrasound will give me a immediate feedback and predict whether vein treatments will help. That when they do have a rash, it's called nummular eczema. Nummular eczema is the medical term, and nummular basically means kind of a oval or circular, circumscribed patch. And very often these people have been treated for months or years with various steroid creams without resolution because the underlying inflammation source is still there, the vein circulation problem. And when that gets treated, it goes away. If people have had a patch for years, and some of them have, what they can expect is the patch will lighten up, but they're they often get permanent skin changes when it's been there for years. And so I tell them the patch will lighten up, but you may still have a kind of a faint patch that persists if it's been there for years. So Dr. Michael Ryan answering the question, how do I know if a skin rash is related to my veins?